Have you been having chronic lower abdominal pains associated with painful intercourse and sometimes infertility? Then this video is for you. Today we're going to be talking about endometriosis. What is endometriosis? What are the signs and symptoms of endometriosis? That is, how can you know that you have endometriosis? How can you diagnose endometriosis? So stay tuned to the end of this video. This is Stop Pregnancy with Dr. Noella, where we tell you all about pregnancy and other women-related health issues. So if these are the kind of contents you like to watch, then click on that subscription button so that you won't miss out on any. First thing is, endometriosis is not a cancer. Endometriosis is a condition where the inner lining of the womb is found out of the womb. That's this inner lining that sheds out during your period is found out of the womb. That's crazy. That's absurd, but it occurs. Now, how does it occur? What happens before you start seeing an endometrial tissue out of the womb? First thing is, you should know that endometriosis is common. It occurs in about 6 to 10% of women in their reproductive age. So it is very, very common. Now, in women who have chronic lower abdominal pains, about 71 to 87% of these women have endometriosis. If you have to really understand what endometriosis is, I made a video on how the menstrual cycle or what happens in a woman's body before she starts bleeding. After this, you can go and watch that. So you see that when you want to see your menses, you see the inner lining of the endometrium thickens, preparing for the arrival of a baby. But if you don't get pregnant, that inner lining which has been thickened is going to shed out as blood. As you are seeing your menses, that endometrial lining which was found in another place, it is also bleeding in that area. So you see that you tend to have that chronic pain too during your period. Now, how does endometriosis occur? What happens before you're going to start having an endometrial tissue out of the womb? The first theory, there are many theories which have been postulated, which a lot of experts had come up with to see what happened before they started seeing these endometrial tissues out of the womb. The first is what we call retrograde menses. It means that if as you're bleeding and the blood is going down, some of the blood can go through the tubes and get into the abdomen, that's the pelvis, and reaches the ovaries. So you see that maybe as the bleeding is occurring, some can go through the fallopian tube and reach and spread into the abdomen and the ovaries. Other theories talk about through the blood vessels. Once you're bleeding, it means that there's like a breach, there's like a blood vessel which has been opened somewhere. And you see that these endometrial tissues, they're just small tissues, they're very tiny. Some can enter into that blood vessel and go to any part of the body through the blood vessels. Another theory is what we call direct transplant. It means that, like for example, during a cesarean section or any abdominal surgery, and maybe they're operating you for fibroids, during that time they remove part of the endometrial lining and it touches maybe the intestine or it touches the ovaries. You know, during surgery there are a lot of manipulations, but you might not know that it has actually a small tissue had come out and touched there. So that's like direct transplant. Another one is through the embryonic rest theory. What does it mean? It means that some ligaments that connect the womb to the umbilicus. So there you see that during that time, embryonic life, that's when you are in the womb. When that time that the womb is coming from that umbilical part going down, it can leave part of these tissues at that point. So there are so many speculations. Other people talk about that it's an immune disease where it just occurs that the endometrial tissue finally reached there and started having those properties. Other people say it's genetic, that because your mother had it, your sister had it, you too have a chance of having it. So these are just the various theories which have been set forth on what can really happen. But most of the common ones that many people talk about is the retrograde and the blood vessels. And where are the common places that these tissues can be seen? The first and the most common place is the ovaries, because you see that the ovaries is just like the first place where the fallopian tube comes and stands. So if, for example, you have the retrograde, the first part that is going to touch is the ovaries. Then we also have the pelvis, because it can fall into the pelvis, that's inside the abdomen. It can fall there, touch intestines, so it can grow even on intestines. It can grow out of just the pelvis. There we can see that it can grow in the skin, it can grow in the lungs, it can even grow in the brain. We have seen here that it can be transmitted even through blood. So how can it reach the brain? It can pass through the blood and reach the brain. So you see here that it is something really difficult to diagnose. What are the common signs and symptoms of this? What make you think that you have endometriosis? There are three symptoms of endometriosis. So the first is dysmenorrhea. Dysmenorrhea means that you have pains during your period. The second one is dyspareunia. That's you have pains during sexual intercourse. And the third is infertility. So if you have these three things, there are high chances that you might be having endometriosis. But there are other pathologies that have this. But we're going to see now the difference with the pain. Now with the dysmenorrhea, there's primary dysmenorrhea and the secondary dysmenorrhea. Primary dysmenorrhea means that from the first time you started seeing your period, you started having pains. That one we can say it's the way your system is. Secondary dysmenorrhea means that from the beginning you were not seeing pain during your period, but out of a sudden you started having pains during your period. Another place where this endometriosis can be seen is in the womb. That's in the uterus itself, inside the body of the uterus. That's what they call adenomyosis. Your menses. So here we're going to be talking about secondary dysmenorrhea. It means that before you were not having pains and now you start having pains. And this pain tends to be progressive. It tends to increase. Why is it increasing? You know, if you just have just small tissue that has gone to another place, endometrial tissue that has reached another area, you see that it still has to take time for it to grow. So as you're bleeding inside your womb, it is bleeding in that other place. So maybe you might feel just small pain during that time. Then the next period, the pain increases. The next period, it increases. So it is progressive and increases with time. And you see that you tend to have these pains only during your period. You can start having these pains 1 to 2 days before your menses even starts. Then it pains throughout the menses and even stays after your period has stopped. So those are the kind of characteristics about this endometriosis, the kind of pain that you feel, which is different from the normal dysmenorrhea. Therefore, it aggravates with time. That's because now as it is bleeding, the blood in that place is also increasing. The blood in that place is also increasing. It is mounting up. So as it keeps on increasing, the pain also increases. So that's the characteristics for the pains during in for endometriosis. Then dyspareunia, it means that you have pain during intercourse. Here the pain is usually the deep kind of pain. During intercourse, there's pain at the level of your lower abdomen when you're feeling that pain. Then you can see that this pain too can be more when you are still preparing to see your period, let's say 1 or 2 days. Like I said, the pain can increase 1 to 2 days before you see your period. So yeah, if you have intercourse 1 to 2 days before your period and the pain is more intense, you start thinking of endometriosis. So these are the kind of ways that you can see. Then with infertility too, it can cause infertility. I'm going to make a video after this for you to see how endometriosis can cause infertility. How can we manage? How can we diagnose endometriosis? Imagery techniques. The first thing is you can do, the most common one is the ultrasound scan, which can be done, and there you can see a mass maybe at the level of the ovaries, abdomen. You can see masses there, the various kind of lesions. Then main diagnosis of endometriosis is a laparoscopic surgery. Laparoscopic surgery means that you're using cameras to get into the abdomen. So you're actually seeing inside just with cameras. You have small instruments which are just sent into the abdomen. Then they use the camera like a TV outside and they're seeing inside the abdomen. So there you actually see the endometriosis, and it has a particular kind of characteristics where the doctor is just going to know that this is endometriosis. Now we have other things like they can do a kind of a lab test, they can check for markers, they can do histopathology. Histopathology means that they have seen this mass, they take it and they send it to the lab and see that it has the characteristics of the endometrial lining. That is how you can actually confirm again that it is endometriosis. There are other techniques that can be used. So these are the most common things. This is what endometriosis is all about, and it is common than we think. It can cause chronic lower abdominal pains, it can cause infertility, and it can cause pains during sexual intercourse. What are some of the complications of this endometriosis? It can lead to scarring, is inflammation, it can lead to scars, it can form adhesions, it can cause infertility, like I said, it can rupture, it can burst and cause now an emergency, cause infection, it can cause obstructions, it can affect the intestines and block it, and you are not able to stool. But it is rare that it causes cancer. So if this was helpful to you, give a thumbs up to our video. And if you want to have a private consultation, you can click on the link on the description box and get to us. So after this, we're going to be talking about how does endometriosis cause infertility? How can it be cured? And what are the possible treatments of this endometriosis? Thank you. God bless you.